So what about if somebody's listening to this and they have a more established practice, mid-sized? What are the kind of challenges and issues with medical billing at that stage?
Yeah, I mean, I think, there's a ton of challenges there, especially with established, right? You might be, one, you might be growing, right? So you're vertically trying to grow, you're trying to add more providers, maybe more locations, whatever it might be. Or even if you're, I call it horizontally growing, like you have like a great established practice, you're just trying to keep it going, right? So you might have staff turnover, you might have whatever, but you just want to keep the engine moving, right? And I think the challenges here for practice managers specifically is they're wearing multiple hats because even at an established practice, right? We talked about a brand new practice, which may just be 1 to 2 employees, right? A provider and one person that does everything. At an established level too, there's still maybe more employees, but the practice manager is wearing multiple hats, right? So maybe they're filling in for the front office side, right? They need to run the administrative part of the practice. They may have a biller, but they might have to hop in and help that biller, right? Or they're the biller themselves, depending on if it's a, one doctor established or two doctor established practice, right? They're wearing these multiple hats. And I think that's often the challenge for a lot of them is just, having to do so much and thinking about, how overwhelming that might be in one case. But then, as you actually get into billing, some of the nuances and the challenges that kind of pop up there because it's one thing to like I set up the claim and I send it, right?
Right.
Another thing is it's not just that simple, so it's not an easy button and then you get paid, right? There's of course in the US healthcare system there's a lot of tricks and nuances and things you have to deal with, and some of the things you run into is your claims will reject, your claims will deny, and rejection and denial sound like the exact same word. They have a little bit of different context in billing, right? So rejection is more of a front end thing. Imagine, for instance, like if you're filling out a form, right, and it flags for you that something's not filled out, right? That's kind of like what a rejection is. It's like a front end thing. Hey, you should consider doing this. A denial is essentially you send your claim, it goes to the insurance, insurance reviews it, then weeks later, month later, the insurance comes back and says, no, you actually can't get paid for this because of, you know, uh, lack of eligibility, because of this, whatever it might be, right? There's multitudes of things there. And that's essentially those things that can kind of occur. That's where it really piles up and it snowballs. There's a big snowball effect for practice managers because you have multiple hats you're wearing. You have maybe imagine you're doing hundreds of claims a month, but then now it's like extra every month because you have all these denials or things that never even get responded to, and that can be really challenging for them because you feel overwhelmed a little bit because there's so many things that you have to get back to, and those things that are neglected are often the things that can become high risk for you not to be able to actually collect on those or get reimbursed.